mRNA vaccines have been credited with helping slow the COVID-19 pandemic and saving lives. Robert F. Kennedy Jr. disagrees. On Tuesday, the US Health Secretary announced he was cancelling nearly $500 million worth of grants and contracts for their development, affecting 22 projects to fight respiratory viruses like COVID and the flu.
Most of these shots are for flu or COVID, but as the pandemic showed us, mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. To replace the troubled mRNA programs, we're prioritizing the development of safer, broader vaccine strategies.
Infectious disease experts have condemned the announcement as dangerous, noting mRNA technology is safe and future pandemics will be harder to stop without it. Kennedy also claimed the vaccines can help encourage new mutations and prolong a pandemic, but scientists note that viruses mutate regardless of whether a vaccine exists for it. On social media, epidemiologist Abra Karan said mRNA vaccines for COVID saved millions of lives. To forget this just a few years later is a big mistake. Infectious disease doctor Jake Scott argued it wasn't mRNA technology that posed a risk, but instead abandoning the most adaptable, scalable vaccine platform we've ever had. And Rick Bright, a flu expert who was ousted as the head of a research division at the health department during the first Trump administration, denounced a bad day for science and a huge blow to our national security. RFK Jr. is a longtime vaccine critic. Since he was appointed health secretary, he's pulled back recommendations around the COVID-19 shots, fired the panel that makes vaccine recommendations, and refused to offer a vigorous endorsement of vaccinations amid a measles outbreak.